Thank you very much. My name is Kokou Adambounou. It's a great pleasure for me to be among you here in Birmingham to attend this international conference in medical physics. Before I start, let me tell you that my English is not very proper, and I think that you will be tolerant with me with my weakness. I'm come from Togo, which is a small developing country in West Africa. We are French-speaking country. We are colonized by France, and we learn French, and we done all our study in French. I'm a medical doctor and specialized in diagnostic radiologist. I have also done my PhD in biophysics at University of Tours in France. And I am associated professor of biophysics and medical imaging in University of Lomé, Togo. The title of my communication is Knowledge and Attitude of Togolese Radiographers on Medical Irradiation of Pregnant Women. In introduction, let me tell you that medical use of ionizing radiation is the largest source of radiation worldwide. The benefit of the use of ionizing radiation in medicine for over 100 years are undisputed. However, its use should be wisely and sparingly done. The biological effects of ionizing radiation are real and sometimes dangerous to women. These biological harmful effects, whether they are deterministic or stochastic, are more pronounced in children, especially in pregnant women. Therefore, exposure of pregnant patients very often leads to a concern disproportionate of the risk and inappropriate behavior. The phobia of X-ray often leads health workers to deprive pregnant women of some medical imaging technique, even though they were justified. Others still ignore risk of exposure of pregnant women to ionizing radiation prescribed as first-line medical imaging radiation to the pregnant women. The respect of radiation protection rule for pregnant women allow necessary continued training in radiation protection, which actually is mandatory in developed countries for all medical staff using ionizing radiation. The medical training and seminar on radiation protection are sorely lacking in developing countries like Togo. One rarely wonders about the condition of exposure of pregnant women to ionizing radiation in Togo. In practical sessions in diagnostic radiology and nuclear medicine, the responsibility of an unjustified exposure of pregnant women with ionizing radiation lies with both prescriber and the operator of examination. We therefore undertook this work, which has the objective to assess the knowledge and attitude of radiographers on the irradiation of the pregnant woman. Our material and methods. Our study was a cross-sectional study with a questionnaire realized in April 2011, filled by 72 radiographers in radiology department, both in public and private health facility in Togo. The questionnaire was divided in 3 parts. The first part concerned the demographic data of the radiographer. The second, the knowledge about irradiating medical, imaging, and biological effects of ionizing radiation on pregnant women. And the third part concerned the practical guide to radiation protection adopted during exposure of pregnant women. Our results. As 38 radiographers, which represent 52% of our radiographers, practice in University Hospital Center. 8 radiographers, which represent 11%, were working in regional hospital center, and the remaining, which represent 36%, were working in private clinics. 25% of the radiographers have experienced less than 5 years, and 33.3% have experience between 5 to 10 years, and 41.7% have more than 10 years of professional experience. If you remark this table showing the distribution of medical imaging examination using ionizing radiation according to the health structure of radiographer, we can remark that the quarter of the Togolese radiographer thought that MRI uses ionizing radiation. 45.5% of Togolese radiographers did not know that scintigraphy used ionizing radiography, and some radiographers working in university hospital center thought that echography used ionizing radiation. If you observe this table showing the distribution of medical imaging modality absolutely contraindicated in a pregnant woman according to the health structure of radiographer, we can remark that the majority of Togolese radiographers knew that any medical imaging using ionizing radiation is not absolutely contraindicated to a pregnant woman. The quarter of them thought that CT is absolutely contraindicated to a pregnant woman, and 8.3% of them thought that conventional radiography is absolutely contraindicated to a pregnant woman. It is important to notice that all the radiographers in our study knew that the medical community is not the only source of exposure to ionizing radiation. When we look at this table, we show the distribution of correct answer to question about radiobiology of pregnancy according to the professional experience of radiographer. We can remark that 88.8% of Togolese radiographers know that if an X-ray examination is justified, it can be applied to a woman in genital active period after the first 10 days of her menstruation. The large majority of Togolese radiographers know that there is less risk to perform an X-ray to a pregnant woman in the third quarter of the pregnancy, and just over 0.5% of them know that the diagnostic radiology deliver rarely the dose susceptible to generate fetal malformation. The large majority of Togolese radiographers did not know that an radiologic examination performed to a pregnant woman can be responsible for a cancer early or later in the unborn child. When we look at this table showing the distribution of correct answer to question about good attitude of radiation protection according to the radiographer's health structure, we can observe that the majority of Togolese radiographers did not ask the date of last menstruation to pregnant to women in genital activity before performing them the radiologic examination. None of them did not record the exposure parameter on a card when they exposure the pelvis of woman in genital activity with ionizing radiation. The majority of them wear apron to a pregnant woman before performing them the radiography examination, and 83.3% of them have already refused to perform X-ray examination to a pregnant woman because it was not justified. Our results deserve to be discussed. The physical principles of various medical imaging modalities are not all based in use of ionizing radiation. It is important that operators had to master very well all modalities before performing irradiating examination especially to pregnant women. It is comforting that all Togolese radiographers knew that conventional radiography and CT scan are irradiating technique, but it's pity that 5% of them working in university hospital center and having more than 10 years of professional experience assume that ultrasound use ionosine radiation. The ignorance of physical principle of nuclear medicine by 44.5% of Togolese radiography can be partly explained by the lack of nuclear medicine department in Togo. The quarter of Togolese radiographers thought that MRI is ionosine radiation procedure. This disappointing result is not surprising if we know that according to the study done in France by Gervais and all in 2011, almost 10% of French prescribers also believe that MRI uses ionosine radiation. The pregnancies, as affirmed by quarter of Togolese radiography, is not an absolute contraindication for CT, even though safety is very irradiant. Indeed, as it's also known by majority of Togolese radiographers, pregnancies is not an absolute contraindication to any irradiating examination. It is only a relative contraindication. Since the examination is justified, it can be performed to a pregnant woman. The occurrence of malformation effect imply exposure of pregnant women at a dose above the threshold of 100 and 200 milligrams. These dose thresholds are, as stated in 52% of Togolese radiographers in our study, is not generally exceeded during diagnostic radiology examination. Our study revealed that the most erroneous knowledge on irradiation of pregnancies women were collected from the radiographer with more than 10 years experience, and this is due to the lack of training in radiation protection in our country. Interestingly, the study performed by Ongolo Zongo and all in 2013 shows a similar situation in Cameroon, another African country, according to which more than 80% have never participated in radiation protection training. Radiographers should always keep in mind that the risk of stochastic effects inherent to any exposure inherent to any exposure to ionosine radiation. This risk of stochastic effects, as it has been pointed out by 61% of Togolese radiographers, can generate a cancer at early or later in children. Therefore, it is understandable that exposure to pregnant women should be avoided to possible amounts, either pregnancies is known or not. Finding out pregnancy in female patients is the initial responsibility of both the doctor who has prescribed and the radiographer who has realized the examination. The doctor and the radiographer must always inquire for this possibility. It's therefore worrying that the majority of Togolese radiographers did not incur the date of last menstruation from a woman before performing the X-ray examination. This bad attitude of Togolese radiographers is also observed in 82% of radiographers in Ivory Coast, another African country, according to the study done by Kwame and all in 2009 in the radiology department of Abidjan. The study reported by James and all in 2011 shows that this neglect in the initial search for pregnancy in female patients is unfortunately observed in nuclear medicine service in Australia. It's urgent that continued training on radiation protection must regularly organized for radiographers. This continued training, safety training, should also be extended to the prescriber to that level so that they can stop prescribing an inappropriate ionosine radiation examination to pregnant women. Let us, in conclusion, we will say that the level of knowledge and of Togolese radiographer on irradiation of pregnant female is relatively acceptable and vary according to their health structure and professional experience. Good attitudes are not always adopted upon exposure of pregnant women to ionizing radiation. This might be related to lack of regular training in radiation protection in Togo. Effort still need to be done by health authority as well as radiographer to ensure judicious and rational exposure of pregnant patients to ionizing radiation in health center in our country, Togo. Ladies and gentlemen, dear colleagues, I arrive at the end of my presentation, and I thank you for your attention.
This paper is now open for questions.
What is the level of training to become, or education to become a diagnostic radiographer in Togo?
They are educated during 3 years ago. They were educated during three years. Now they have to have a master's degree. The education is done during 5 years.
So a master's degree.
A master's degree now. But 5 years ago, they have also, the education is done in 3 years, and they have license. Now they have master degree graduates. They are formed during 5 years.
So with a master's degree, they're still not getting that knowledge or training about
Please?
radiation. In a 5-year degree, they're still not getting that level of training.
I don't understand. I'm not, your accent, I don't.
That's all right.
I've got a question.
Yes.
Over how long of a time did it take for you to do the survey?
The survey, 3 months.
Over 3 months.
3 months.
And then do you intend to repeat this survey in the future, maybe a few years from now, to see if things have changed?
Yes, this study we've done with the radiographer which have been educated for 3 years. Right. Now, as we have started to educate them in 5 years master degree, after that we will do another study and to verify if the knowledge change have changed.
So do you anticipate that when you do your study 3 years from now and all of your participants have had their master's degree before doing their training, you would expect better results?
Yes.